Substance abuse is a social issue, not a criminal one. What is the issue? Substance abuse should be considered a social issue rather than a criminal one because it stems from deeper rooted problems like poverty, trauma, and mental health struggles. Instead of focusing on punishment, viewing it as a social issue highlights the need for treatment, prevention, education, and community resources. This perspective argues that criminalizing people who use drugs does not address the root causes of addiction and often worsens the outcome, while a public health approach can reduce harm and support recovery. My reasoning for this topic. My end goal for college is to graduate with a master's in social work and go on to be a licensed social worker. There are many topics I'm interested in involving social work, but substance abuse has to be in the top 3. I've had many people in my life struggle with substance abuse, friends and family. I've always been interested in what led them to getting to the point of being addicted. There are so many people struggling with addiction. Approximately 16.7% of Americans are struggling with substance abuse at this moment. Where is this primarily taking place? Substance abuse, as a social issue, is most evident in communities facing poverty, limited access to healthcare, and high levels of trauma. This issue is especially concentrated in low-income urban neighborhoods, rural areas with limited treatment centers, and regions heavily impacted by unemployment and underfunded public health systems. It takes place within hospitals, schools, shelters, and family environments, not inside the criminal justice system, where addiction often goes untreated. This situation shows that the harm of substance abuse is rooted in social conditions rather than criminal behavior. Why should this issue be resolved? This issue needs to be resolved because criminalizing addiction does not reduce drug use or improve public safety. Instead, it increases stigma, incarceration, and long-term harm. Incarceration is a wasteful tool for reducing substance use disorder. High-quality treatment services reduce drug rates. Treating substance abuse as a social issue supports prevention, recovery, and community well-being. A public health approach saves lives, reduces overdose rates, and lowers health and social costs and helps restore the dignity of people affected. It also strengthens families and communities. Resolving this issue helps break cycles of trauma and poverty while promoting safer, healthier environment for everybody. How can this issue be resolved? This issue can be resolved by shifting from punishment-based responses to health-focused strategies. Key goals would include increasing access to treatment programs, expanding mental health services, providing harm reduction tools like Narcan, reducing stigma, and improving social services such as housing and employment support. Education programs in schools and communities can prevent substance use early on, while policy reform can redirect people with addiction towards treatment instead of jail. What strategies are being implemented? Several methods are already being used nationwide. Many cities are opening more treatment centers, including medication-assisted treatment programs, harm reduction services such as needle exchange, overdose prevention sites, and mobile outreach teams are helping to reduce deaths and infections. Police departments in some areas are adopting diversion programs and send individuals to treatment rather than court. Public health campaigns are increasing awareness about addiction and connecting people with resources. In one recent community-level intervention, applying comprehensive, evidence-based practice was associated with 37% reduction in overdose deaths among people using opioids and stimulants. These methods show a clear shift towards treating addiction as a health issue. Who is being impacted? Many groups of people, directly or indirectly impacted by the issue. An estimated 46 million Americans aged 18 or older experienced a substance use disorder in 2022, and nearly two-thirds of those people, 13.1 million, were employed. This means workplace, families, and communities bear the impact, not only the individual dealing with addiction. This quote also might put into perspective how everyday people like our coworkers can be suffering with substance abuse and we might not even know. Potential challenges and obstacles. Several factors make it difficult to fully treat substance abuse as a social issue. Stigma continues to prevent people from seeking help, while many communities lack enough treatment centers and mental health services. Among adults with substance use disorder who did not receive treatment, 95.6% did not think they needed treatment. This illustrates a lack of perceived need, often from stigma and denial or lack of awareness. Funding for public health programs is often limited, and political disagreement slows down policy change. Additionally, some people still believe addiction is a personal choice rather than a health condition, which fuels criminal justice-based approaches. These barriers make it hard to create consistent and effective support systems. Final remarks. To create real change, we must work together to shift how society views addiction. Instead of punishing people who struggle with substance abuse, we can support solutions that promote healing, safety, and hope. By advocating for treatment access, mental health resources, and harm reduction strategies and supportive policies, we can reduce overdose deaths and strengthen our communities. Join this movement to help reframe addiction as a social and health issue, because when we treat people with compassion and provide real support, everyone benefits from it.